Common misconceptions. Kidney disease is surrounded by several myths, often stemming from a lack of knowledge and awareness. While some people take kidney diseases so seriously, whereas I've seen some others ignore it at its initial stage. But whatsoever, it may affect you severely. It may be fatal sometimes. Kidney disease is a serious condition and you should neither be so anxious nor ignore it even if you have a mild condition. I can understand that you might be confused by the popular misconceptions related to kidney disease, but they all have to be debunked so that you would have a clear understanding and get over your condition without any delay. Hello and a very warm welcome to all of you. I am Dr. Neha. In my today's video, I will debunk all the myths related to kidney disease and I'll try to shed light on the reality of people living with kidney disease. So let's begin our video without any delay. So the first myth, myth number 1 would be kidney disease affects only old age people. Well, the fact is it is the most common myth that kidney disease only affects older people, but that is not at all true. While aging does, of course, increase the risk of kidney disease, but even if you are young, you can have a kidney disease. Several factors are responsible for developing kidney disease in people. It does not merely depend on the age factor. Myth number 2. If you have kidney disease, you will have symptoms right away. Well, the fact is many people think that kidney disease manifests immediate and they have noticeable symptoms, but that's not the truth. In the first 2 to about 3 stages, kidney disease is often silent. However, your body shows some visible symptoms during the 3rd stage. Your kidney get damaged up to 90% before the symptoms actually appear. That's why we call this as a silent disease. Hence, you must go through your regular checkup, especially if you have diabetes and blood pressure. Now, let's come to myth number 3. Drinking lots of water in kidney patient can help reduce the symptoms. Well, in this case, the fact is hydration is of course important, but drinking excessive water in kidney patients cannot reduce the symptoms. If you have chronic kidney disease, then you must maintain your water intake as it can put more strain on your deranged kidneys. Drinking more water will only harm your kidneys further. Instead, you can manage your condition by consuming a kidney-friendly diet, regular exercise, regular walking or light exercise, and monitoring your blood pressure and blood sugar levels. Now, myth number 4. Kidney disease is rare. Well, the fact is, do you also think that kidney disease is a rare one? If so, you are wrong here. More than 850 million people have some sort of kidney disease worldwide. In fact, 1 in 7 adults in US have chronic kidney disease. And even many of them are not even aware of it. Myth number 5. Only people with a family history will have kidney disease. Fact. Yes, genetics can be a major reason, but that's not the only true thing. Several factors contribute to the development of chronic kidney disease. For example, high blood pressure, diabetes, excessive alcohol intake, certain medications taken for a very long period of time, your lifestyle, your stress, and everything. Even if no one in your family have had kidney disease in the past, you can still be at risk if you don't take care of your kidneys. Myth number 6. Dialysis is the only treatment available for kidney disease. I would like to state a fact here. If you think that dialysis is the only option for kidney disease, then you are wrong. Kidney disease can easily be treated with effective drugs, effective medicines during its initial stages with lifestyle changes, a kidney-friendly diet, mindful activities, and holistic and natural medicines. Homeopathic medicines are very, very safe, they're very, very effective, and they bring improvement in kidney disease in a comparatively lesser time. Unlike allopathic medicine, which causes severe side effects in your body in the long run, homeopathy is absolutely side effect free. So dialysis is not the only or probably the last option. You can manage your condition with homeopathic medicines also. Myth number 7. If one kidney fails, you can live with another kidney. Well, the truth here is it is not true in every case. It is only true for people who have had dysfunctional kidneys since childhood or someone who has donated one kidney. They can live with a single kidney. But for people who have chronic kidney disease or lost their one kidney due to cancer, injury, infection, then there is less possibility to live longer with one single kidney. Well, I think I've debunked all the common myths associated with kidney disease. Again, I would like to say here that kidney disease is a serious issue. You should not ignore it anyway, or you should not be confused with any misconceptions. And don't worry about it. It is easily treatable with alternative medicines. Homeopathy is now a very prominent approach to treating several kidney problems. Bharat Homeopathy has a record of successfully treating thousands of patients worldwide. We are a team of doctors who do proper case taking, understand the patient as a whole, and prescribe personalized medicines and customized homeopathic treatment based on patient's constitution, based on the specific symptoms that the patient has. If you have any doubts related to kidney disease or homeopathic medicines or how this system of medicine works, then you can just give us a call and talk to us today. I think you found my video helpful. Please like and share and subscribe to my Bharat Homeopathy YouTube channel. Thank you and have a nice day.